The technology that we have developed during my PhD, which is called Polarisation-Sensitive Optical Coherence Tomography. So we use this technology to image the back of the eye, the retina, and the blood vessels that are located there. The idea is to find a correlation between those blood vessels of the retina and the heart. So basically what we are doing is to simply find a way to find associations between the eye and the heart. My name is Hadi Afsharan, and I'm a research fellow at the University of Western Australia and Perkins Institute of Medical Research. I got my PhD in 2023 from the University of Western Australia, and since then I'm working at Perkins in the South Branch with a close collaboration with clinicians at the FHRI Stanley Hospital. The major turning point for me was realizing that the technology developed at the bench in the lab at the university can be translated to the clinical practice. This realization inspired me to pursue translational fellowship, where it provided me a platform to lead my research and do the things that I like more to help people with different diseases, especially cardiovascular ones. So I did most of my university education back in Iran. So I did a bachelor in physics and then a master's in photonics, where the physics and electronics get together. It's basically photonics is about using lasers and optics for different reasons. In my master's in Iran, I did a research on biophotonics, which I used the light and the lasers to help cure cancer. After that, one of the major points was getting an interview with one of the professors here at the University of Western Australia, where they offered me a PhD position here at the Oval Labs, where I could pursue my passion in applying optical and engineering in medicine. Since completing my PhD, I've been working with clinicians at the FHRI Stanley Hospital to translate the technology that we have developed during my PhD, which is called Polarization-Sensitive Optical Coherence Tomography. So we use this technology to image the back of the eye, the retina, and the blood vessels that are located there. The idea is to find a correlation between those blood vessels of the retina and the heart. So basically what we are doing is to simply find a way to find associations between the eye and the heart. Or in easy terms, we are using the eye as a window to the heart. Also, we have another project that I'm responsible for, which is using sensors and radars to measure jugular venous pressure on the neck to help people with heart failure to manage their disease. JVP stands for jugular vein pressure. What this means is that for the patients with heart failure, their heart usually struggles to manage the fluid properly. And because of that, they are going through a very cruel cycle. So these patients get released from the hospital, they discharge from hospital, they go home, and after a couple of weeks or months, they have to come back to the emergency room because of this mismanagement of the heart. And currently there are no methods that can monitor this phenomenon. So what this sensor can do, we hope what this sensor can do is to measure the JVP, and then based on these measurements, tell the patients that their heart is getting weaker, so they go to the hospital sooner so they can get the health care needs that earlier on. Radars and these sensors have been used in commercial vehicles, like automatic cars or automatic trains, or even in airplanes. But nobody has ever used these technologies in medicine. So we are now find a method to translate this technology, which was outside medicine and outside hospital, into clinical practice, where our system is located at the CCU at the Fiona Stanley Hospital, and we are recruiting patients who are struggling with their heart to measure their JVP and then help doctors and clinicians to better for the patients to have better outcome. So nationally, I'm working with engineers and biomedical engineers at the University of Sydney, and I work with a broad audience, consumers, and also a body called WA, Western Australian Cardiovascular Association, where I work. So in terms of consumers, I work closely with a company called Hearts for Hearts, which help other patients with the heart disease to get together and communicate with each other, and also communicate with other researchers to find their passion, and also to help other patients to get the health care they need. I am funded through Western Australian Department of Health. I have been supported by 2 fellowships, Translational Fellowship and Innovation Fellowship, both from Future Health Research and Innovation Fund from the Department of Health of WA. My passion comes from my childhood, where I saw my grandfather, who had suffered from heart disease, who went from a person that could do everything by himself to a person that needed other people most of the time in less than 2 years. So this inspired me to continue to go on a route that can help other people like my grandfather to become less and less, to suffer less and less from cardiovascular diseases. When I joined UWA to start my PhD, I met other clinicians who were passionate about what they were doing at the time, and they were looking for ideas for technologies to help patients with cardiovascular disease to have a better life. So that's initiated my research, and then to come to where I am now. Outside of work, I'm very active. I like playing volleyball with my friends when I have time, and also I love playing table tennis. So my PhD supervisor is really good at, and usually when we had time during my PhD, we played table tennis a lot. So he inspired me to become more active, actually, because one of his rationales was that to become a good researcher, you need to have a good physical activity. You need to have a good physical body. So that's stayed with me since then, and now I'm very active. And also I love going on hikes and going into different locations, looking at the sky and looking at the sun, especially when it rises or when it's down.